988 is a game changer. It allows people to call and speak directly 24 hours a day to a real person, to a clinical specialist who can walk them through what they're dealing with in the moment, but also connect them to resources. And I am so grateful to Dr. Feeback for her initiative in ensuring that 988 is available throughout our metro area.
So our region has created a 988 steering committee, and with that there is representation from every community behavioral health center. Dr. Feeback also is a part of that committee as a representative of CommCARE and our call center that receives all of the calls for 988. We work alongside each other as partners to identify how to best serve our community together with this 988 service offering. So we look at how do we create protocols? How do we create the system of care together? We also look at things like how do we get the word out?
988, because it is a nationwide hotline number, and then if you exclusively focus more on from a regional perspective, it's all about who's at the table. Because at the end of the day, our goal is to meet people's needs within our community. Who's at the table is the community mental health centers. Sometimes we have law enforcement at the table. We have EMS, first responders.
When we had Mental Health Awareness Month, Dr. Feeback took it upon herself to identify how could we really promote 988 and the Crisis Lifeline during that time. And so our community was able to see the hotel light up in green, the Ferris wheel light up in green. We saw trucks going out into our community that had 988 lit up in green along the side of them. That all came from Dr. Feeback.
And so the lights, if you think about a dark room and then you bring light into it, that light provides some hope. And so that was really one of the initiatives, because that's what 988 does. It provides hope. Because we would park those trucks at random places, random events, concerts, a Royals game, it created attention. So people would come over to the trucks and we were all there with some of our swag. You know, we started talking about 988 with them. Some of them knew about 988. That was really inspiring. Some of them said, I've called it 3 times and it's helped me every time.
She first came to me at KCPD and she really wanted to start a partnership to divert calls from 911 when appropriate to her call takers at the 988 Lifeline. One of the things was that my 911 call takers were very nervous about sending calls away from a police response and to an outside agency or outside resources, because they are very much wanted to get it right and they didn't want to leave someone who really needed help. But this way, because they have gone to training face-to-face with Dr. Feeback, they know who she is, they trust her, they trust what she brings to the table about the 988 Lifeline and the program.
And I know how hard it is for people to make that first call, to acknowledge that they're struggling, perhaps with even taking their life. So to have a non-emergency number that is confidential, accessible, and staffed by knowledgeable mental health clinicians is absolutely vital for the life of our community.
So her team here at CommCARE is answering the phone 24/7, making sure that everybody within our region has somebody to reach out to at any given time. Beyond that, she also oversees a multitude of programs with CommCARE. She oversees the EPIC program, which helps those that are experiencing opiate addiction. She just cares so much, and she wants everybody to not just know but internalize that there is somebody to call.
Dr. Feeback, her passion for mental health and connecting with the community is just awe-inspiring, and I feel like she has been a real force for change in Kansas City. Anytime we're getting more resources to people and more assistance to people on the street in their homes right when they need it, then that's a win-win for the whole city.